We have so many questions about COVID-19. In fact, more questions than answers in some regards. Dr. Mateo specializes in infectious diseases and chronic infections at Sanford Health. Thank you for being here again today. Have we learned anything new in the last week?
There are four notable developments that stand out in my mind.
Okay.
So firstly, there's a lot of talk about the modeling that's out there to determine how this epidemic curve is going to go for the United States. I sort of focus more specifically on what's going on with North Dakota. And what we're seeing is that potentially our epidemic curve is going to crest somewhere between the 3rd and 4th week of April.
New information. We have not heard that.
Secondly, I think a lot is now being more appreciated about asymptomatic individuals who are actually infected. So the estimate is about 20 to 25% of individuals who get infected will never show up with any symptoms, but they can still potentially be contagious and spread infections to other individuals. A third finding, especially in the clinical front, is that we're beginning to appreciate more how individuals with infection can actually manifest other types of symptoms besides fever and shortness of breath and cough and malaise. There are reports where folks, the first thing they notice is some sort of cardiac event. There can be some neurological symptoms from this particular syndrome. I think it's already been mentioned that sometimes the first thing people will notice is that they lose their sense of taste or smell. And it turns out that there can be rashes and GI, gastroenterological symptoms, nausea and diarrhea that can be associated with this.
Some things to be aware of.
I think what will be helpful, however, for people to realize is that there's actually a study going on right now at the University of Minnesota Medical Center where individuals who know that they've been exposed, family members or healthcare workers, know that they've been exposed to a COVID-19 positive individual, can actually avail themselves of a prophylactic treatment. So that's available actually online. The entire study is done online. You can sign up for it, you can fill out the surveys, and they'll ship the medications to you.
Okay.
So you don't even have to go to Minneapolis, St. Paul.
And very quickly, we've heard new guidance on people wearing masks for personal use. Are your views changing?
They are. I'm beginning to appreciate how in a lot of Asian countries, Singapore, Japan, Hong Kong, the general population adheres to the social distancing that we talked about before, but they wear masks, and not just for reasons of air pollution, but this is the time of the year when they have influenza-like illnesses. They realize that this mask that they wear is something that can help prevent the spread of their own cough and sneeze that potentially can affect or infect other family members or neighbors or friends. So that's what they do, and they are convinced that that is a main part of why they've been so successful in flattening their curve.
Okay. And you agree? Possibly.
I absolutely agree.
All right. Thank you so much for being here and for the latest information on the coronavirus, including the governor's daily briefings, resources, case numbers, the interview here with the good doctor, and prevention. Visit our website, kxnet.com.